I want to talk about an interesting case that I did recently. This case is a jaw implant, chin implant revision, and a revision deep plane neck lift. So I'm Dr. Regina Rodman. I'm a double board certified facial plastic and craniofacial surgeon. And this patient came after having two jaw and chin implants. The second one was a custom jaw and chin implant. He felt like it was still crooked, like it was still lopsided. He had a deep plane neck lift. All of this was done somewhere else, which he felt just gave him a little bit of a cobra deformity and really didn't help the symmetry or the balance. So we got a CT scan, and this CT model showed us this is what his implant was, how it looked. And so it was not his imagination, it was indeed very crooked. So one implant was really winging out, giving a lot of definition on one side, and then the other one was actually sitting below the mandible. And then the chin, despite it being a custom implant, was very crooked. And as I mentioned, this was done elsewhere, but I was able to see what was happening by getting this CT scan. So I designed a custom implant. In this case, we designed a titanium implant, and I wanted a titanium because he wanted some length to the jaw and some vertical height to the chin. A rigid material really needs to be used, and he had already had a silastic implant and saw how it shifted and came cattywampus, so I felt like titanium was the way to go. So I designed this custom titanium implant to give squareness and a little more vertical height to the chin, more projection to the jaw. And this is him afterwards. You can see straightened the chin, gave some nice definition to the jaw angles, and I love the result. He's happy with it. He has just come back recently, last week, where we did a revision deep plane neck lift to help some of this heaviness and fullness and see that beautiful jaw implant a little better. So stay tuned for those photos. And this is common. I often, if I need to do a big bony surgery and a facelift neck lift, will stage those two. So this before and after is after the first stage, which was the revision of the chin and jaw implant. I just did the neck lift last week, so we'll be posting photos later. I generally space these about 6 to 9 months apart so that swelling can come down. Then when I go back and do the neck lift to really clear the contents of the deep neck and give definition, 6 to 9 months is good so that swelling can come down enough that I can really see how much I need to pull, how much I need to lift. So those photos will be coming soon, but this is the result of stage 1 jaw implant revision.